Welcome to Roger That, a podcast presented by HVAF of Indiana. I'm your host, Lauren Carpenter, and join me as we discuss how HVAF is ending veteran homelessness and how you can join us in our mission. We'll be having conversations with community partners, staff members, and even some of the veterans we serve. We hope sharing more of our story with supporters like you can shine a light and give a voice to this vulnerable population, because no hero should ever be homeless. Welcome to the very first episode of Roger That, a podcast presented by HVAF helping veterans and families. I'm your host, Lauren Carpenter. I'm also HVAF's marketing and communications manager, and I'm so excited to launch our podcast. We wanted to do this so you all could just have a deeper look into HVAF and veteran homelessness and just, what you can do to support and join our mission. So Roger That will cover topics such as veteran homelessness, both on a local level and a federal level, and what HVAF is doing to end veteran homelessness. We'll also be talking with our community partners and even some veterans that we have served. And actually, episode 2, stay tuned, is going to be an interview with a veteran that we have served. So we're very excited for this and just be able to share our story in a whole new way. And so if there are any topics that you want us to cover, any questions you want us to answer, please let us know. My email is lvcarpenter@hvaf.org, but don't worry, I'm also going to include that in the show notes. On this episode, I'm going to share a little bit more about HVAF's programs and services and what we do to serve veterans in central Indiana. And then we are going to be joined by HVAF CEO Emmy Hildebrand. She has a wealth of knowledge on veteran homelessness in Indianapolis and also on the federal level. And then, we're also going to discuss, how HVAF is addressing and solving this problem. So without further ado, let's get into the very first episode of Roger That. HVAF was founded in 1993. So yes, we are celebrating 30 years this year of serving veterans who are homeless or at risk of homelessness in central Indiana. HVAF's mission is HVAF of Indiana houses, supports, and advocates for all veterans and their families to help them achieve the best quality of life. HVAF's vision is hope, housing, and self-sufficiency for all veterans and their families. And we strive to fulfill our mission and vision each day by providing these programs and services to Hoosier heroes. So first we have housing. We are a housing first agency where we believe the first step in ensuring a veteran reaches self-sufficiency is by making sure they have a roof over their heads. We have properties around Indianapolis, either temporary or permanent housing for our veterans and their families. Those living in our housing are also connected to one of our case managers on staff, and they help connect them to the necessary resources in order to reach self-sufficiency. We also provide short-term rental and utility assistance for veterans and their families who are currently homeless or facing eviction. We also provide employment services. Our employment specialists help our veterans build their resumes, hold mock interviews, and place them in a job that's right for them. One really cool program we were able to start 2 years ago, thanks to a grant from Lilly Endowment, is VetWorks. VetWorks, which stands for Veterans Workforce Renewing Knowledge and Skills, is an intensive 3-phase work, learn, and earn program designed to skill up our veterans to achieve their earning potential. Veterans complete on-the-job training, they have access to education and certifications, and they receive assistance with obtaining a good and promising job. HVAF also has a food, clothing, and hygiene pantry open to veterans on Tuesdays and Thursdays each week. Also, donors can contribute clothing, non-perishable food items, and hygiene products to the pantry, and volunteers are always needed to keep the pantry sorted and stocked all year long. I'll add contact information to learn more about our volunteer opportunities and a link to our Amazon wish list in the show notes. Every day, Navy veteran Rodney goes out to Indy's homeless camps and serves the veterans in need. He builds trust with them and encourages them to come to HVAF for the help that they need. Recently, thanks to the Colts Kicking the Stigma initiative, we were able to hire a full-time therapist. Keisha provides intensive individual therapy, including individual and family counseling, substance abuse psychoeducation, sexual trauma counseling, post-traumatic stress disorder treatment, and suicide prevention. And last year, we were able to provide 33,157 services to 1,265 veterans. Also in 2022, 185 veterans were permanently housed, 260 veterans received employment services, and we had 2,254 pantry visits, and we were able to distribute 68,674 pounds of food and clothing to our veterans. Okay, I know that was a lot of information at once, and there is even more that I could share, but don't worry, we're going to get into all of that in future episodes of Roger That, so stay tuned. But all in all, HVAF is doing amazing things to serve veterans in our community, and that is because of our supporters. So thank you so much for supporting our mission and helping to end veteran homelessness in Central Indiana. And to learn more about HVAF and the veterans we serve and how you can join our mission, be sure to check out our website at hvaf.org. And now let's get into our conversation with HVAF's CEO, Emmy Hildebrand. All right, I am here with HVAF CEO, Emmy Hildebrand. Emmy, how are you today?
I'm well. How are you?
I'm good, thank you. Thanks for joining on our very first episode of
Happy
Roger
to
That.
be here.
Yeah. So excited to, get this podcast launched. I know we've talked about this, I think, since like last summer to do something like this. So
yeah, the day is finally here.
Yes, it is. Yeah. So let's just get started. So first, if you just want to share a little bit about yourself, how just kind of what's led you to being CEO of HVAF today.
Sure. My whole career, I've spent working for veterans and with members of the military and their families, trying to provide assistance when they need it. I was fortunate enough to start in the county service office in Putnam County, Indiana, which is my home county, during a winter term break from DePaul University. And a county service office is really the front line of veterans assistance in the state of Indiana. Each county has one. It's usually one person who is there to assist veterans with their disability claims or to get enrolled VA healthcare at Raudebusch Hospital, and just a variety of different things. And I really enjoyed that. I really enjoyed being able to make a difference in people's lives and see firsthand the help that we could provide. So when my internship was wrapping up, the county service officer suggested that I reach out to Senator Lugar's office and do an internship there. He said it would be just like the county service office, but on a statewide level. So I was fortunate enough to do that during my senior year at DePaul. And I was even luckier to get hired at the end of my internship, where I spent 10 years working for Senator Lugar. I did a couple of things. I was initially hired. I was a history major at DePaul, and the senator had just kicked off something called the Veterans History Project, which is an oral history program run by the Library of Congress, where we traveled around the state of Indiana interviewing veterans about their time in the military. It was a really good fit for me, having been a history major at DePaul. Yeah. But during my time in the senator's office, it was also kind of the peak of the global war on terror. So Indiana was seeing more and more service members deployed, and sadly killed in action. So there was just more assistance needed for members of the military and veterans, and I was able to step into that role as well. So when he retired in 2012, I started looking around thinking, I don't know what I want to do. Let me just kind of cast a wide net and talk with people that I've been working with. And one of those groups was HVAF. So I met with the CEO at the time, and he was telling me they really wanted to get into more of a public policy and advocacy role. So it was perfect. I could bring my government experience, my passion for veterans, and kind of hit the ground running here. So I started here in the fall of 2012, which I can't believe has been 11 years ago now. Started solely doing public policy and advocacy, and that's kind of expanded. I took on grants and special projects and was fortunate to be promoted to CEO in 2021.
Yeah. So, looking back at 2012 and then now today in 2023, 11 years there, what's been the changes and the improvements that you've seen here at HVAF?
There's been so much change since I started here at HVAF. First, the size of the agency. When I started, we were under 50 employees. Okay. Because one of the first issues I had to tackle public policy-wise was how was the Affordable Care Act going to impact HVAF? And we just crossed that 50 employee line where we were required to offer health insurance benefits. Now we're a team of 75, so pretty significant growth. But we've also expanded the programs that we offer veterans, both in terms of the specific services, but also the number of veterans that we're serving. When I started in 2012, we were primarily a transitional housing agency. We operated almost 200 beds of transitional housing spread across all of our properties. Today, we offer 121 transitional housing beds, but we've added a pretty significant rapid rehousing program, which was just starting in 2012 here. But now we're serving, about 400 veterans a year with our rapid rehousing program. And we've also expanded into permanent housing. So we're a landlord now. We have 62 units of permanent supportive housing. So we're really able to offer kind of a menu of housing options for veterans. So we can meet each veteran where they are, offer them a housing option that fits their need and their family's need, and hopefully help them achieve self-sufficiency. We've also added an employment program and then expanded it with VetWorks, which is really a workforce development program. We've added legal services and transformed our pantry too. So now we're more focused on treating our veterans with dignity and respect when they come here. And we're all like hyper focused on customer service and being a place where veterans want to come, not have to come.
Yeah. Yeah. I've been here since 2017. So I've seen a lot of changes too, even in that time. So it's been really cool to be a part of it and see, how we've been able to like change and adapt and just be able to continue to serve even more veterans. So why would you then say that you are proud to be able to lead HVAF?
So my whole career, I really just wanted to make a difference in the lives of others. When the senator retired in 2012, I took a look at corporate jobs. I'm like, what motivates people to go there? What do they get out of it? Because here you get to see firsthand the impact that we're making in the community. A veteran comes to the pantry in need of food. We're able to meet that need, and we get to be a part of that. So I'm really honored to know that we make such a difference in the lives of the veterans we serve. I'm also really honored to work with a really great team of staff. We've got 75 people who come to work every day, ready to serve, regularly go above and beyond to make sure that the veterans and the families we serve have what they need.
Yeah. I feel so proud to be able to work here. And, when I share with, friends, family, about what I do, I say I work at a nonprofit that helps veterans who are homeless or at risk of homelessness. And, they're, everyone can get behind that, right? Like everyone, can support someone who sacrificed their life for our freedom, and then they're kind of shocked that there's even an issue with this, right?
Yes, absolutely. I think it's kind of mind blowing for them to realize that a good portion of those experiencing homelessness are veterans. There are men and women who, since 1973, volunteered to serve our country, did so very well in most cases, and then come home and they face struggles and end up homeless. I think that it's also a real tragedy to think about the sacrifices that people make on our behalf. It's time away from their families. It's time that they're in physical danger. It's, all kinds of things that we take for granted. And then they come home and end up on our streets. So I'm really glad that we get to work towards ending that here at HVAF.
Yeah, definitely. So let's kind of go maybe first on a federal level, kind of the bigger picture. What does this problem look like with, how many homeless veterans there are and, male versus female? Just what would you like our listeners to know about that?
I would start off that veterans are much more likely to be homeless than non-veterans, especially women veterans, which is the fastest growing segment of the homeless population. I think both of those are always shocking for people to hear. Yeah. And I'll be a little bit of a nerd for a minute, but I've done a lot of research on what happens when someone goes into the military. And it's really interesting because we know they're more likely to be homeless when they're out. But veterans are also much more likely to have college degrees. They're higher income earners than non-veterans. So I think a lot more research needs to be done to kind of figure out what sends some veterans on a successful path and why do some struggle. But it's happening across the nation. And the 2022 point in time count, there were over 33,000 homeless veterans in our country. Which is a lot. But it's actually a pretty significant reduction. In 2010, under President Obama, the Secretary of the VA announced an initiative to end veteran homelessness. In 2010, it was a 5-year plan. We're obviously well beyond that. Yeah. But I think what we've seen in these last 13 years is when you focus effort and resources to address an issue like veteran homelessness, you can make a really a huge difference. And so since 2010, veteran homelessness nationwide has been reduced by 50%.
Yeah. So it's great that, we're doing something right, but of course there's a lot more work to be done. So, and then now let's take it on the local level, how, I guess in Indianapolis specifically,
Sure. So I'll take a pause and explain a little bit about the point in time count so people understand what that is. But every January, every community in the U.S. is required by the Department of Housing and Urban Development, HUD, to literally go out and count the number of people experiencing homelessness on a single night in their community. It's wildly inaccurate. You can't do this well, but it's the only method we have to kind of gauge, the extent of homelessness in our community. Mm-hmm. So in January of 2022, 167 veterans were counted in Indianapolis as experiencing homelessness. IUPUI, the university here, actually consolidates all of the data and puts out a report, and they estimate that the true number of veterans who will experience homelessness is 3 to 5 times what's counted on that night in January. Oh, wow. Okay. So it's still a pretty significant amount. Yeah. We did celebrate all of 2022, though, because that's a 35% reduction from what it was in 2021. And I think, again, to my point earlier, that shows what happens when you have effort plus resources. You can make a big impact. And we have been fortunate to receive significant amounts of COVID-related funding from both HUD and the VA, specifically to serve the most vulnerable veterans during the pandemic. Yeah. And that made a big reduction in veteran homelessness in our community.
Yeah, definitely. What would you say can lead a veteran to become homeless? Because I think that is something, why people are shocked is because they think that, because they served, we think so highly of them and respect them. So how are they even in a position to where they're homeless?
So I think there are a lot of factors, and they're pretty similar to non-veterans. The primary reason is lack of affordable housing, which we're starting to see here in Indianapolis, especially in the sort of center township downtown area. To rent an apartment is like really, really expensive. Yeah. But in cities like New York and LA and San Diego, those rental costs and housing costs are extraordinary. So that's the number one thing. Some other factors are unemployment. I don't think that people understand that military service can be a big disruption to your employment, especially if you're like a member of the National Guard or Reserve, or even a military spouse where you've moved from location to location. So veterans sometimes start a little behind in the workforce. Then the other issues are mental health and substance use, which we see a lot of here at HVAF. I did my blog in May was about mental health. So I looked at some data, and almost 80% of the veterans that we've served so far year to date report a mental health diagnosis.
Seeing all the numbers, knowing, what causes veterans to become homeless, what is HVAF then doing, with this information and, trying to solve this problem?
So we're really fortunate to have, again, a talented team of staff and a lot of clinical staff that can, work with veterans one-on-one and get to the root of some of these issues that they're facing. So in terms of affordable housing, we have a really robust rapid rehousing team, and they spend a ton of time networking with landlords in the community and finding safe and affordable housing for veterans to move into. I mentioned earlier, we do that for about 400 families a year. That's the work on affordable housing. In terms of mental health, and this is part of our strategic plan, is adding an in-house therapist to serve the veterans that we are housing and serving in our other programs. So, often it's really easy when you get referred from agency to agency to kind of fall out and fall through the cracks. So we want to eliminate any barrier to treatment and make it really easy for a veteran who's already in HVAF programming to see an HVAF therapist at no charge. We have one now, and we're hoping to expand that over the next 3 years and expand it beyond just the veterans that are enrolled in our housing to any veteran in the community that needs that assistance. Yeah,
you mentioned the strategic plan that we just, launched this year. So I guess then, what are some of the other kind of goals and initiatives with the strategic plan?
Sure. So I mentioned part of goal 1, which is expanding our mental health services here within our current footprint, which is central Indiana. But we also want to take a look at some underserved areas around the state. We know that a lot of members of the military come from rural areas of the state, and that's often where services are not as robust as they are in more urban and metropolitan areas. So we're going to take a look at the veteran population in the state, see if there are concentrations of veterans who are lacking housing supports or mental health or employment services, and see if there's an area that we can step into and provide some assistance. Goal number 2 is expanding our services in our current area, which would include the mental health services, but also substance use. During the pandemic, there was a ton of articles about increases in overdoses and substance use, and veterans are impacted as well. A few years ago, I was meeting with a member of Congress, and they told me that the VA was the largest prescriber of opioids in the state of Indiana. Most people get started using opioids with a legitimate prescription. Right. So I think there's an area for us to do that here as well. Yeah. Our third goal is just about organizational sustainability. I think what we saw during COVID is that programs can grow very fast to meet a need, but you also have to have a strong backbone to support all of that. So goal 3 is all about that. So we are setting really robust fundraising goals, which thanks to your team to get that done. Because we know that, we receive, and we're lucky to receive a lot of federal funding through grants from the VA, but it's not enough to meet all of the needs that we want to meet in the community. So that'll be really helpful. We also are implementing goals for, cash reserves and financial policies and HR policies to make sure that the organization is strong, both fiscally, but also in terms of our people. Yeah. We are kicking off, training sessions, and we have a diversity working group here in the agency, just to make sure that we're providing a supportive environment for our staff also to do this important work.
Yeah. Yeah. And I know you mentioned how you do a monthly blog earlier, and then something I've noticed whenever you go and speak is you just know a lot of statistics on top of your head, but also they're very important and they're very eye opening. How do you keep up and follow this?
I have a lot of Google alerts to start with, but I think that in order to best do all of our jobs, but my job specifically, I have to know the issue. I have to understand what's going on. So obviously I have a chance to chat with staff here and hear their perspectives. But I also am plugged in to the Government Relations Committee on the National Coalition for Homeless Veterans. That way, when I speak, I'm sharing accurate information, but it's also eye-opening, kind of like we talked about earlier. Once you sort of fully grasp the situation, it's really shocking to a lot of people. Yeah. But once you grasp it, you can start to solve it.
Do you have I guess maybe a cool story or an interaction that you've had with one of the veterans that that we've been able to serve?
Yeah, I think one of my favorite stories is it was during the height of the pandemic. So at that time, I supervised our community center, which includes our food and clothing pantry. And we were trying to be very careful about staff burnout and concern, because in those early days, everyone thought that if you got COVID, it was really bad, and you're probably going to go to the hospital and maybe die. So we wanted to be sensitive to how staff were feeling. So I covered the front desk on Fridays so that team could take a break from that sort of face-to-face interaction with veterans. It was towards the end of the day, and I had a veteran ring the doorbell, and he was like, I just need some food. Can you help with that? I was like, absolutely. So I got a backpack, and I was packing it full of all these cans and all of these things that I thought would kind of get him through the weekend. And I took it out to him, and he was like, oh, thanks, but save this for someone who needs it more. I just need this can of chili. The rest of it, someone else will get more use out of. I think it was just a reminder that we take so much for granted. Yeah. And there are people who are happy to just have a can of chili for the weekend. It's I think a good reminder of the work that we have to do here, and also how fortunate and blessed that we are in our own lives too.
Is there anything else that maybe we didn't cover about, that just the numbers on veteran homelessness, any other information that you'd want our listeners who may not be familiar with this topic, what anything else that you want to share that they could take away with?
Yeah, absolutely. There are two areas I want to highlight. The first one, it's really relevant to what we're seeing right now, is food insecurity among veterans. Actually, 1 in 9 veterans and 1 in 4 active duty service members are food insecure, which means they don't have enough food to maintain a healthy lifestyle. I think it's shocking to a lot of people, especially those on active duty, to think that there are people in uniform right now who don't have enough food to feed themselves and their families. And we're seeing that here in our pantry. Between 2021 and 2022, there was an 11% increase in grocery costs across the country. And that has driven more veterans who are just kind of on the edge of needing assistance to have to come to our food pantry. So we had 270 veterans come in the month of May, which is the most we've had in quite a while. Year to date, we've distributed over 21,000 pounds of food through our pantry. So we're on track for a record year there as well. And our pantry is fully stocked by donations from our community. So people listening can make a huge difference if they donate non-perishable items, donate money and designate it for our pantry, or even go on our Amazon wish list and make sure that we're able to offer basic nutrition supports to the veterans who need it the most. The other issue I want to talk about is veteran employment. We're really lucky to have a team of employment specialists who have networked with employers, but we're always looking for more employers who want to work with the veterans that we're serving. Because the sustainable income is the key to getting out of homelessness. It helps you afford your own place. It helps you move on without further support. So we're always looking for more employers who want to work with us as well.
Yeah. Well, thank you so much, Emmy, for taking time and sharing more about veteran homelessness and what HVAF is doing to address this problem.
Sounds good. Thanks for having me.
All right, that wraps up this episode of Roger That. Thank you so much for listening. If you haven't already, please be sure to subscribe to Roger That on wherever you get your podcasts. And be sure to follow us on social media at HVAF of Indiana. And for even more stories on HVAF and the veterans that we serve, check out our blog on our website at hvaf.org. Thank you, and until no hero is homeless, we'll see you next time on Roger That, a podcast presented by HVAF of Indiana.